Hey guys, this is Lawrence of the Ketones and Coffee podcast. Make sure to subscribe down below so you don't miss out on any of this great content. I'm so excited for this, guys. Our guest today is a licensed mental health counselor with 15 years of experience providing behavioral, cognitive behavioral, and dialectical behavioral therapy for her clients. Also uses the ketogenic dietary therapy as a treatment for mental illness and neurological issues to help people explore medication-free options for their mental health using a research and evidence-based nutritional psychiatry so that people can get their lives back without side effects or dependence on big pharma. She also started a mentalhealthketo.com. That's mentalhealthketo.com, a blog dedicated to providing education for people about the impact of nutrition on our mental health. I'm so excited for this. I am here with Nicole Laurent. Nicole, welcome to the show.
Thank you. I'm excited to be here.
Love it. I'm so excited to have you on today. Truly, I finally crossed paths with a licensed mental health counselor who actually believes in the effects of nutrition, aka, you practice a ketogenic diet for our mental health. What we are about to talk about today, nutrition and mental health, I believe is what has really drawn me into this lifestyle. So many guests on the show. I was talking to you about this, before we went live. Who swears by keto or carnivore to help their anxiety and depression symptoms. Today we get to dig in deeper on how that works.
Yeah.
So excited for that. So before we get into keto and mental health, I'd like for our listeners to get a chance to know you a little bit. You were a you have a very successful career as a counselor. You had
Mhm.
a master's of arts in clinical psychology. Also, you talked about a profound health experience that led you to this path of nutritional therapy for neurological disorders. Before keto, first I want to ask you about your career in psychology and what has led you to this path. Is this something that you always wanted to do, or what is the story behind you taking this path of health?
Yeah. So I went into my psychology program just like everyone else, wanting to learn to do good work,
Mhm.
and learning that the standard of care is, particular types of psychological treatment and medication. And actually, it's kind of ironic because in the beginning of my program, I started to develop a chronic pain condition,
Mhm.
um, and I was having trouble getting treatment for it, and I ended up, later on I learned, oh, there was a particular operation I could have had, or whatever. But back in those days, it was opioids, it was hardcore medications. And after speaking to lots of doctors and just being desperate, so I was getting chronic migraines and trigeminal neuralgia, which is facial pain, and it's one of the most painful conditions. So by the time I finally got to a doctor who was like, "Well, we just better prescribe you something for relief," I was desperate and I was terrified, and I was asking me, "Now you're sure we can get
Mhm.
me off of this? You sure this isn't going to be a problem later?" And they completely kept telling me, "No, no, this won't be a problem." So I went through my program on these medications, um, and towards the end of I mean, I did fantastic. I got straight A's. I mean, when I look back now and I think about what I went through, and what I was taking and how I was trying to function, I just have so much love for her, for past me. And I did amazing. But I couldn't, and then finally they gave me an operation, and I got a neurostimulator implant that ran up my spine and kind of reprogrammed those nerve cells, and that fixed it. But then I was stuck on these medications, and it was awful. It was awful. And finally they did a bridge medication, but that took a long time. That had hospital visits, that had failed attempts, that had liver damage, that was a big ordeal. Finally got on a bridge medication, was stuck on that, harder to get off of than heroin, right? And so finally I finally found a doctor that had a protocol that could get me off of those medications. And I mean, by then I had really developed a lot. I had developed, I
Mm.
would call stage 1 Alzheimer's disease.
Mm.
If I looked at the diagnostic criteria and I saw what was going on, I I met that criteria. I was beginning to believe that I needed to retire early because my brain was not working.
Just to clarify, is this from the medications you were taking?
I think it's a combination. So I'm APOE 3/4, so I have an increased risk for developing mild cognitive decline
Mm-hmm.
early.
Mm-hmm.
Um, Medications, those particular medications and all psychiatric medications can really cause something called, what is it, drug-induced nutrient deficiencies.
Mm-hmm.
I think that put my brain risk at health, and the medications that they use to get you off of those are they're nerve damaging. They're brain damaging. I could barely walk for a month
Mm-hmm.
after that detoxification.
So
Like, they're no joke.
how long
Yeah.
did they tell you that you have to take these medications? Is it until a certain point amount of time, or do you have to be on this since you've had the surgery?
No, so that's it. I had the surgery, it fixed it, and then I couldn't get off the meds, and now I've been off
Mm.
for quite a few years.
Mm.
But after I got off, my brain still didn't work.
Mm.
Like, I thought I was going to have to retire, and this is after years of doing psychotherapy and doing good work. But my brain energy was low.
Mm.
I would forget names. My job is talking. I have to be able to find words. And there was times where I was like, I can't find the words that I need with this client right now. And it was terrifying.
Mm.
And so then, I'm still doing therapy, still managing to do good work. And then what I found was that I came across some podcast somewhere that talked about ketogenic diets and talked about all the benefits of it. And I can't remember what podcast it was, but of course it got me going with a whole bunch of other podcasts, right? I started to not be able to get enough of these podcasts because I was trying to figure out how to fix my brain.
Mm.
Um, and they didn't actually talk about it fixing your brain, but they were talking about all of the benefits, right? The health benefits and how it upregulated mitochondrial function, the nutrient density, that type of thing. And so then I got excited and I tried it. And my brain just unlocked and leveled up in a way that I can't even describe. Like,
Mm.
I think my poor little brain was starving for
Mm.
years and years
Mm.
before they experienced ketones. And I was super excited.
Mm.
I'd be like, I tell my husband, like, oh
Yes.
my gosh, I just said this, thing that I hadn't thought about in 10
Mm.
years. And it just came and I could remember this. And before that was an issue. And so it was huge.
Mm.
And it was life changing.
Mm.
And my brain just kept getting better and better and better. And so then I'm sitting with clients and I'm doing psychotherapy with clients, and the standard of care is I'm supposed to send them off for meds, even if it's mild. Really, they want therapy and medication. But
Mm.
anyone who is a mental health counselor knows this. We don't talk about it. We're not supposed to talk about it.
Mm.
But we have clients that'll come and be like, yeah, I started this new med. And then a week later, 2 weeks later, they're right back where they began.
Mm.
We get clients where it's difficult to do psychotherapy with them because they're emotionally numb. We get
Mm.
people who are on a lot of medications that then just decide they don't need to do
Mm.
therapy because they're not really feeling the thing anymore.
Mm.
We get a lot of people who have such side effects from these medications: sexual dysfunction. They start having brain fog and memory issues, and they have absolutely no idea that there is something else that just
Mm.
works so much better, that is a multi-interventional treatment,
Mm.
right? You start taking antidepressants, or you start taking various
Yep.
psychotropics. They're really working on just one pathway. Ketogenic diets work on like four to six different interventions that really work towards brain health.
Mm.
And my clients are sitting there and they have no idea that this exists. They're absolutely suffering. Some of them are responding to therapy, but some of them aren't, because quite frankly, therapy is hard work and you
Mm.
need a semi-working brain to do the work. It's
You,
hard.
Mike, I had a counselor before. People who have listened to the previous episodes, you heard me talk about my struggles with, in the past with anxiety and depression. When I started keto, I really was looking to lose a few pounds, but I had no idea that keto can actually help my symptoms. Not until I started my podcast, did my own research, it
Mhm.
started to dawn on me, where I started to connect things. In that moment, I told myself that I needed to be a part of this. Like what you're saying. If my counselor, going back um a few years when I was doing cognitive behavioral therapy,
Mhm.
if this was an option for me, and I don't know how this works, if it were how this works for you, for your clients,
Mhm.
but if this was an option for me, I am desperate enough to to believe
Yeah.
it, to do anything. Because even though I struggled through depression, I never wanted to take any medications for it. Maybe because I didn't want to accept it, and medication is always going to be my last resort. That doesn't mean I oppose the use of medications for
Right.
your symptoms. It definitely helps many people. It's obviously we have different degrees of symptoms, right? It definitely helps many people cope in everyday reality. But if there was an alternative, I would do that first. I believe so. I
Yeah.
believe so.
Yeah.
So I've gone through many therapies, like you said.
Yeah. Yeah. And it's hard work.
Mm,
And the you know the and the and that's the thing. Like if you are using medication and it has helped you stay alive, I am so grateful for
mm,
that, right? Not you particularly, but people in general. And if you have found medication to be effective in treating your mental health symptoms, that is fantastic.
mm,
But I am telling you that that is not the majority of what I see. And I don't believe for 1 minute that it's the majority of what other mental health counselors see.
mm,
And I have a very strong belief that everybody has the right to know all the different ways that they can feel better.
mm,
It should be an option that is discussed in psychotherapy circles, among psychiatrists, among mental health counselors, among social workers, among addiction counselors, because there is evidence to support the
mm,
ketogenic diet for use in mental illness, and particularly mild cognitive decline and brain issues. And when I when I fixed my brain on the ketogenic diet after having all of that damage, like there had to be a lot of damage because I was really struggling to function.
mm,
I did notice, and this was made me think, oh, this should be my clients should get to know about this. I did notice that I was so chill. I didn't have any idea
mm,
that I was walking around with this constant kind of low grade anxiety
mm,
that I would use all my skills that I would teach clients, I would use on myself. I didn't know that I was managing this low level, low grade, constant sense of anxiety. And that lifted when I did the ketogenic diet,
mm,
probably within 2 weeks. And I had no idea that was going on. And if you think about it, it makes perfect sense because a brain that is starving, a brain that is using up all of its nutrients to try to heal neuroinflammation and deal with oxidative stress, or
mm,
medication damage, or just poor health, whatever, that brain is not going to make the right balance of neurotransmitters. It is going to make it's going to imbalance those neurotransmitters to make more of an excitatory neurotransmitter called glutamate.
mm,
Glutamate is normal. You're supposed to have some glutamate, but there's a big portion of that glutamate that needs to get made into GABA. And if your brain is not healthy, you're not going to convert it to GABA. You're going to stay in high levels of glutamate. And glutamate, I always tell clients, because it's just a simple way to explain it, when you have too much glutamate, it's kind of your freak out neurotransmitter. Someone's stressed out, someone's having a panic disorder, someone just can't
mm,
stop ruminating. That is an excitatory neurotransmitter imbalance to some degree.
mm,
And so, of course, if my brain was starving for fuel, of course, if my micronutrients were low, of course, I'm living with a low level grade of
mm.
anxiety. And so is a lot of other people. And they don't get to talk about it and they don't know about it. And the mental health counselors, we're discouraged. We're not supposed to talk about this. This is out of our lane. And I'm just tired of that. I think people have a right to know about this as a treatment.
I love that. But what does medicate for people that are maybe on medication or curious of taking any medication, any type of medication for their symptoms? What does the medication do? Is there a
Mhm.
general way to explain that? What does it
Yeah.
do, as compared to like a dietary therapy?
Yeah. So when you go to a psychiatrist and you get different medications, and of course it's more complicated than this, but different medications work on different neurotransmitter pathways. So you might get a serotonin reuptake inhibitor, right? So what that does is it wants to keep more serotonin in the synapse. And there are different types of reuptake inhibitors for different types of neurotransmitter systems. And sometimes you will get psychiatrists that give multiple ones trying to make a brain work,
Mm.
right? And those are really only trying to work on those particular neurotransmitters. And what's kind of funny but not funny, is that let's say you go to your doctor and you get a serotonin reuptake inhibitor, but you are nutrient deficient in B6, zinc, and
Mm.
iron. That reuptake inhibitor is going to help you only keep in the synapse what serotonin you do make. If you don't have those precursors
Mm.
in your diet and you're not absorbing them or whatever, you're not going to make more serotonin. That serotonin reuptake inhibitor is only as good as the
Got
amount
it.
of serotonin that you're able to make.
Mm.
And that serotonin reuptake inhibitor is not going to help you make more melatonin at night so you have a normal healthy sleep to heal your brain. Serotonin
Mm.
needs certain micronutrients in order to make melatonin, right? I mean, these interventions are just not comprehensive.
Mm.
I mean, it's kind of fixing one thing. It's robbing Peter for Paul. It causes nutrient deficiencies that we don't talk
Got it.
about. But a ketogenic diet. So if you go to my blog, mentalhealthketo.com, and you look up the different disorders, what I've done there is I was like, okay, so how might a ketogenic diet help different mental illnesses? And I found that ketogenic diets basically modulate four factors that contribute to different mental illnesses. One is oxidative stress, neuroinflammation, neurotransmitter imbalance, and brain hypometabolism. And I was very curious. I was like, okay, which of those four factors is involved in PTSD? Which of those four factors is involved in panic disorder, social anxiety disorder, depression, OCD, right? So I was like, I'm going to look at all these, alcohol, right? Alcoholism. And in every single one of those disorders that I looked up, you can see in the research literature that one or all of those four underlying pathological mechanisms exist in those disorders. And the ketogenic diet modulates every single one of them,
Mm.
either mostly as a signaling molecule. So, for example, neuroinflammation, you can get some reduction in inflammation, a slight amount with an SSRI, for example. In fact, some people have posited that it's not actually the serotonin hanging out in the synapse that's helpful.
Mm.
It's the slight reduction in the neuroinflammation that is a byproduct of that medication, but it's nothing compared to what you can get, the
Mm.
amount of inflammation going down that you can get on a ketogenic diet, because that ketogenic diet, those ketones are signaling molecules, and they will literally inhibit inflammation in the pathway itself. It will turn those genes off.
Mm.
So I think that the thing that I want to make sure I that your listeners really understand is that we kind of pretend that these medications are the best option
Mm. Mm.
for mental illness. And really that is not the case. The ketogenic diet is, in my opinion, from what I've seen in my clients, what I've seen in my research of looking at what the underlying pathological mechanisms are, what we see all over the internet with people talking about how it's improved their mental health and helped them. I don't think medications are superior. I think
Mm.
ketogenic diets are superior for mental health.
So let me ask you. Sorry to cut you off. So
No, go ahead.
When it comes to medications, obviously it does help in some ways, right? It does help some people get through their day. But what ultimately, what does medications do? If does it, does it treat illness? Does it treat symptoms, or does it, you know, treat the underlying cause? What's ultimately its job to do?
Yeah, it's to reduce your symptoms. It's to
Mm,
reduce your symptoms. Medications are about trying to reduce your symptoms so that you can function. And I would
got it.
say our society uses these medications actually in a really maladaptive way, because I have had, for example, I have had plenty of people who were in great emotional pain in their life because of the situations they were in, and those
Mhm,
situations needed to change. But medication allowed them to
mhm,
stay in those situations and not make those changes.
mm,
So a ketogenic diet is actually treating the root cause of brain hypometabolism, so fuel, right? Mitochondrial dysfunction. It treats the inflammation. It improves the oxidative stress, so it helps the body actually repair the damage that was going on from all that neuroinflammation and the brain starving basically for fuel, right? And it fixes neurotransmitter imbalances. So something is out of whack in the body that is causing those symptoms in the first place. And ketogenic diets are not about masking those. Ketogenic diets are about fixing what has gone wrong.
and that makes me happy. That just makes me happy because I've gone through it. I've went through cognitive behavior therapy. I know cognitive behavior therapy works. And I was given prescription, but I didn't really want to take it because I believe that there still can be done. And I practiced cognitive behavioral therapy. I was given, a few exercises to do, but nothing really comes close to where I am now mentally,
Mm-hmm,
my mental health, my energy, right? I've, a few years back, I have experienced the darkest days of my life when I was depressed. I had the stretch of days where I couldn't sleep. Um, and you know just looking back, it was just such a scary time for me. And if I knew about this lifestyle, the ketogenic diet, and how it helps mental health, it would have given me s- you know those years back, right? But
mm-hmm,
I'm glad that I've really come across this, maybe as a weight loss tool, but afterwards I had connected the dots and really um, just I'm thriving right now. And
mm-hmm.
I wanted to be a part of this mission, like you, when you discovered this um for your improved brain function. I'm like, I need to tell people about this. And I know how health coaches approach clients about keto, but I'm curious, as a counselor, how do you explain the effectiveness of the ketogenic diet to your patients? Or are you even allowed to talk about diets on your sessions?
Yeah. So what that's the thing. So once I had that experience, and I have people in my office suffering, and I know this would work really well from them, but at first I was like, "Hey, some people say this helps," right? I would just really kind of like sneak it in there, and it was because I was afraid,
Mhm,
because
mhm,
I know that, first of all, I'm a mental health counselor. And so if people know that I'm saying, hey, this diet, right, that happens to restrict this particular food group in order to get metabolic and, molecular cell signaling changes, like I'm going to be accused of promoting eating disorders, even though right
mhm,
now this intervention, ketogenic diets are being used to treat binge eating disorder.
mhm,
But it's heresy. It's absolute heresy for me to stick my foot into the nutrition piece. So
mhm,
I went back and I got an additional a postgraduate certificate in nutrition and integrative health. Um, and I got some additional training in ketogenic diets for neurological disorders. And then I did some training under Georgia Ede. And after that, after I kind of got to see a lot of different clinicians using it, and Georgia's a psychiatrist who's in mental health also, I felt more confident, saying, now I just outright say to clients, like, yeah, you can try medication. Absolutely. Go ahead and try that. And let's talk about your nutritional status. Let's talk about your diet, how you're not getting the basic micronutrients you need to make the neurotransmitters that you're upset
Mm.
you're not enjoying. um, and I just bring it up straight out, and we talk about why it's an evidence-based treatment. I like to use ketogenic diets and or broad spectrum micronutrient therapies
Mm.
with people in place of medications, and there's
Mm.
actually a lot of people who are into that, who are like, yeah, I don't want to do the medication, but I
Uh,
use them with therapy, and
yeah,
people just absolutely blossom.
I'm
It's
I'm
great.
curious. I'm curious because, when I was walking into my counselor's office, I always think that it was it was my fault. It was me. I never connected the diet. I never connected, um, eating healthy or quote unquote healthy to my mental health, because nobody around me ever connected that. And so if it would be, right now looking back, if my counselor told said that, I may laugh a little bit, but I'm willing to try everything. But
Mhm.
just looking back, because I know that, mental health, a few years back, is there's such a stigma around that. And I really am, you know when I was younger, I really didn't want to accept that reality. And I'm just really glad that your patients are have this option, that you're, because if that, I'm just thinking back, because if what happened to you didn't happen, and you didn't find out about the ketogenic diet, you're not going to find out about keto and its benefits for your
Right,
patients.
right.
And so this is a journey for you. I love this path, and I'm just so happy for your clients, really. That's
Yeah,
my thought.
yeah, yeah. I'm happy for him too, and and yeah, and I'm working on some different stuff to try to bring it to more people.
Hmm.
When you're in private practice, you only have so many hours a
Yeah.
day, and you can only see so many people nonstop, right?
Hmm. Hmm.
And I feel like this message really has to get out, that this is a viable treatment that really helps a lot of people. So that's why I started my blog, and I'm currently doing program research. I'm wanting to create a program
Hmm.
that, and I'm not sure exactly what it's going to look like, but it's going to be something along where there's this educational component, and then a weekly, once or twice a week actual meeting for people who want to start a ketogenic diet for their mental health, and specifically for problems with cognitive issues like brain fog, that sort of thing. Because I think that that's really helpful. And there are some caveats and some basic kind of knowledge that you need to kind of be aware of. If any of your listeners are thinking, hey, I want to, oh, well, I'm sold, I'm going to go start my ketogenic diet for my mental health, there's a couple of different things you need to be aware of, and I want this on their radar. So one of them is, if you start a ketogenic diet and you are already on medications, you have to be careful, and here's why. Because the ketogenic diet will improve your brain functioning so well that the usual dose of your medications will suddenly be too high, and you will begin to get side effects from those medications. You need to have a prescriber who's on hand and ready to help titrate you down off of your medication or to a lower dose. So before you start your ketogenic diet for mental health, I want you to look up your medications and the side effects. I want you to print them out. I want you to stick them on the fridge. And every day I want you to go by and go, am I having these symptoms? Because if you do, you're having some potentiation effects possibly, and you need to contact your doctor for that. What usually happens is they start to get the potentiation effects and like, oh
Mm,
man, I've got dizziness from this ketogenic diet, or I've got,
mm,
agitation from this ketogenic diet. That's not the ketogenic diet. That's the medication. You need to be adjusted. So that's an important piece. The other thing about doing a ketogenic diet for mental health that your listeners need to know is that you have got to eat adequate fat, and you have got to have low enough carbohydrates to encourage that adaptation for ketones, and to make sure that you have adequate brain fuel. Okay. So if you go online about how to do a ketogenic diet and you end up on some weight loss thing where it's kind of low carb, high fat, that is not quite a ketogenic diet that you need for mental health. Okay. You have got to have very, very low ketones. And with my clients, I always tell them count total carbs and not net carbs. And that's not because I'm being cruel and I want you to have less delicious things to eat, right? It's because the fiber, everybody's gut seems to use that fiber a little bit differently. And so what happens with psychiatric patients is that their brain fuel goes up and down. They're making ketones one moment, but they're not the next. And they're making it one moment and not the next. And that can really exacerbate their symptoms. So if you're going to do a ketogenic diet for mental health, I always tell my clients we're going to shoot for 30 total grams a day for a while, for a good 6 weeks at least, right? Possibly more. um, because that's going to get those carbohydrates down really, really low. You're going to just eat all the fat you want. I'm not worried about your weight right now. I'm worried about your brain fuel. And it takes a little bit of time to get good at unlocking your own fat stores and making ketones out of them for some people. And so I want to make sure you've got some MCT oil on hand. I want to make sure you're having plenty of fat so that you have plenty of brain energy while you're doing this transition. And so those are a couple different factors to keep in mind for your listeners.
the one thing that's running through my mind as you talk about that is I wish I should have I would have I've known you at that time when I needed somebody to talk about this because I yeah it was a dark time, but right now it's a journey for me, and I'm glad that I came across keto, and I'm just happy for your clients, and I'm just happy for people listening right now, that people that everybody has a mental health, right? Basically,
Mm-hmm.
we all
Brain health.
experience, we have a brain health, we all experience downs, we all experience winter blues once in a while. And so I think everybody can really relate to this. I think everybody can really be helped by this diet because, like I said before, nothing comes close to the change that I've experienced on the ketogenic diet. I've done all the therapies. I've done cognitive behavioral therapy. I've I've done all my research on everything else. Just because I was desperate enough to try everything at the time, but nothing really came close until a couple years after, when I found the ketogenic diet, and just almost accidentally uh come across keto. And the thing that was running through my mind was, I hope I've known you back then, so
Mm-hmm.
so I could have um
Got some
had a head
guidance.
start, got some
Yeah.
guy got some head start. Um to to everyone that's listening, I want you guys to be able to connect with Nicole. Nicole, where could they find you?
So the easiest way to find me is my contact form
Mm-hmm.
on mentalhealthketo.com. Um, and you can also email me at Nicole at mentalhealthketo.com. And if any of your listeners would like to help me with my research development, that or my program development, that would be fantastic. I'm looking for people who have brain fog, regardless of their actual diagnosis. So I don't care if you got your brain fog because of depression, anxiety, ADHD, traumatic brain injury, mild cognitive impairment, medication damage, however you identify as having brain fog. Come my way and let's do like a 20, 30-minute call. because I want to hear what your frustrations are in getting treatment. I want to hear what supports you feel like you would need in order to be successful. And at the end of that call, I'm happy to steer you towards semi personalized types of resources that you might find helpful on your journey. Because I totally get that when we're trying to heal our brains, we really are on a journey, and it's really quite individualized. There's many kind of phases to getting your brain health back and different tweaking that kind of happens. So yeah, love that if people would like to contact me for that.
Awesome. I'm gonna link everything down below so you guys can check Nicole and get on the because I'm so happy really right now. I don't wanna I don't know what to say anymore because it's just amazing for people to be hearing about this, and I would do everything I can to push and share this content, and to the best of my abilities, because I really believe in this. I really had struggled with it, and so ketogenic diet has really helped my lifestyle, helped me gain my energy back. Obviously it helped a lot of people. If you're listening to this podcast, you've been listening, it helped many people, and Nicole really has explained in detail and how it really works. And so thank you so much, Nicole, for
Yeah,
coming on and sharing your story. I'm so grateful for you, to what you're doing, to your mission. Man, I want to be a part of what you're doing, and I hope to be connected, long term with you, and share your findings, and I would definitely follow your journey
yeah,
as well. Thank you so
yeah.
much.
Thank you. Thanks for having me.